Hey everybody, so today we're going to talk about human papilloma virus, also referred to as HPV. Now, what is HPV? HPV is a viral disease and it is very infectious and common throughout the world and specifically the United States. It causes warts in the genital, common, plantar, and flat types. It also causes cancer, such as cervical cancer, cancer of the anus, and of the back of the throat. Now, what are signs and symptoms? Could you have HPV? So, if one has lesions or warts throughout the body, maybe in the feet, like a plantar wart or a genital wart in the genital region, they can go to a doctor and get diagnosed, but that's a first and primary suspicion of having HPV. Another way, if you're specifically a woman, you may have bleeding or irritation of the cervix, and you should go in and get tested for that as well. Another thing to keep in mind is some people may have HPV and be asymptomatic and show no symptoms. So right here is a picture of a male with genital warts. As you can see, there's lesions here, here, and here. And he probably went to the doctor, got a visual diagnosis. They probably did an autopsy of it and sent it to a lab just for confirmation. For bleeding or irritation of the cervix, there's a thing called pap smears, and I'm just going to go through the leading cause for cervical cancer and how that process goes. So right here, as you can see, is a healthy cervix, and when someone is infected with the HPV virus, it begins to form into a cancerous tissue, which will cause bleeding and irritation, and that's why you see bleeding between menstrual cycles and maybe like a pink discharge, I believe. Pathogen and virulence factors. Okay, let's look. So proteins E6 and E7 are the major proteins for HPV strains that do cause cancer. And they inactivate the host tumor suppressor proteins P53 and RB. Now let's look at how this does this. Okay, so for the E7 protein of HPV, it binds to the RB protein, and the RB protein, as you can see, binds to the E2F protein, and it stops it from promoting DNA replication and cell division. So basically, when your cells have reached a perfect replicated and divided state, it's like, hey, no more. But what happens is the HPV protein of E7 binds with the RB protein, and it causes there to be an unregulated state and rate of DNA replication and cell division, and this is what leads to cancer development and causing cervical cancers and things like that. How does the E6 protein? Okay, so I always remember that E6 is the destruction kind of protein and E7 is the preventer. So E6, it just kind of, the P53, it slowly like degenerates it and it suppresses it. So as you can see, there's a difference here. E7 binds and just causes it to keep going. This one like inhibits and destroys. And so this is what causes the gene transcription, and then it's just at an unregulated rate and there's no stopping it. So what's the pathogenesis of HPV? Okay, so typically one would get infected through skin-to-skin contact. And this is kind of in this phase, the mucous membranes of the skin, probably slightly torn. This is why you see a lot of HPV transferred through sexual intercourse. So the infected cells of the person who has already been diagnosed or has been infected with the HPV virus would then give it to the person who's not through skin to skin contact. And once that person goes through that right here, the HPV exposure goes through the E6 and E7 proteins that we just discussed. Now, these cause the cells to keep regenerating, and then you have HPV, and after a while, once the cells keep regenerating, you'll have P53, and the RB proteins will be suppressed and broken down, and then that's what causes the invasive cancer right here. And then these right here proteins deal with transcription, and that also causes the unregulated rate of cell division. Epidemiology of HPV. What is the big deal? Okay, so around 20 people are currently infected with HPV, 20 million people. By age 50, 80% of women will have acquired a genital HPV infection, and 6.2 million Americans get a new genital HPV infection each year. So that's why it's very prevalent. You know, you never can be too safe because the numbers are out there. The facts show that people are continuously getting infected. And to this day, we still don't know the method of clearance that our body uses to clear up normal HPV strains, and why we are able to clear some up and not other ones, or how certain people can clear different ones up. We still don't know. So it's very important to know the risks you are taking when you are having unprotected sex or involving in sexual intercourse in any way. Diagnosis, treatment, and prevention. So earlier we went over the visual diagnosis and the pap smear testing. So the doctor will probably visually diagnose you if you have lesions of the genital area or anywhere on the body. Women can get a pap smear to test for abnormal cell division. When you hear abnormal pap smear or something. There's wart treatment, there's lasers and medicines to help with the immune system. There's loop electrosurgical excision procedure, which is also known as LEEP, and that just gets rid of the infected cells of a pap smear. It's important to get cervical checkups because if you have been red flagged as having an abnormal pap smear, you need to realize and keep up with your body and see how your health is managing. And there is also the HPV vaccine. Now, this is a very controversial vaccine, but I'm going to talk a little bit about it. There are 3 types. There's the Gardasil, the Gardasil 9, and the Cervarix. These vaccines, they help prevent the high-strain HPV types of 16 and 18, and they're high-risk strains that cause cervical cancer. This vaccine does not have any live viruses, because if it did, then you would be infecting yourself with the virus. It prevents the vaccine from the ability to cause cancer. So when the body encounters this, it makes antibodies, and those antibodies are used to fight off the real virus if exposed. So those little proteins are taken from the actual virus, and then when your body develops those antibodies, if you are exposed to those, then you've already got immunity, I guess you would say. Those are typically taken when girls are like young adolescents in 3 stages, and it's just a good way to take preventative precautions, because this vaccine does help with the high strains of 16 and 18 that lead to cancer, but they also have been shown to help with 6 and 11, which lead to warts. So, you never can be too cautious. It's just important to stay safe and always keep your health first. And thank you for watching. I hope you enjoyed.